I will now be moving on to having the audience ask their questions. So the first question will be from Haley Falk. She's an English major at George Mason University.
Okay. Hi, Haley. Welcome.
Thank you. It's been so good hearing you talk.
Thank you.
So my question was, do you think that Senate Bill 1179 on ending for-profit prison management in Virginia could possibly be reintroduced in the next General Assembly session?
Yes, I do. There's I voted to end for-profit prison management. I do think that the state can exercise much more control over the programming and the quality of the staff if the state actually operates the prison. It was a rigorously debated bill, and one of the factors that contributed to the defeat of the bill in my committee was the fact that employees around the area where there's one state prison being operated with a private contractor right now, and the community around that prison actually rallied advocates and others to defeat the bill based on the premise that jobs would be lost. So that was that was a big thread in the reason why the bill went down. We tried to make the point that, state jobs, in fact, would pay more and you would get better training, but there's no guarantee that somebody who was, lost the job because a private contractor left would necessarily be hired by the state. And the fear of that job loss was a very big hurdle.
All right. Our next question will be from Marwa El-Alawi, a psychology major at Northern Virginia Community College.
Oh, hi, Mara.
Her question is, what are some of the provisions of Senate Bill 1405 that establishes the Get Skilled, Get a Job, Give Back Fund and Program?
Oh, the G3 bill. Yes, I worked very hard on that and worked with Governor Northam. So I'm so glad you asked that question. It's one of those transformational bills I should have brought up, saying I was proud of. Well, what that bill does is individuals who graduate from high school in good academic standing, if their income is up to 400% of the federal poverty level, which is actually a pretty generous scale, will be able to go to the community college at no cost, as long as they draw down whatever grants they may be eligible for. If they're eligible for Pell Grants or they're eligible for a scholarship, the state will make up the difference. So there would not be a tuition cost passed along to these individuals. The caveat is these individuals would be expected to go into our high demand workforce tracks. And we've defined that very broadly. Teachers, especially math and science teachers, but all teachers, early childhood educators, certainly computer programming, cybersecurity tracks, and nursing, and then of course a lot of the healthcare technician type of tracks. So there are a number of tracks that would probably be very appealing to individuals, and if they again meet that income limit, could get a associate's degree. And what I really like about the program is students could tap into an emergency fund if something happens that could prohibit them from continuing their education. If there was a financial catastrophe, if their car broke down, they missed their rent, childcare bills were piling up, We do have, I think it's up to $1,000 a semester, an emergency fund that that an individual student can draw down. Because what we found is so often it's just life gets in the way of, these very capable students from finishing an associate's degree or a certificate. And it's just very, it's heartbreaking. It's just heartbreaking. I know many of these students, and I know that, they're compromising their future over, a broken car that, somehow they've got to fix, and feel they have to work more hours to fix it, and then they drop out of school. So I feel really good about that program. The other thing I want to say is, for the past 3 years, I have been a force behind the what we would call the dual degree program. So what this does is it sets aside money to train high school teachers to deliver community college level courses in the high school. So some of our school systems in the Northern Virginia region are really tapping in to the dual degree program revenue, and they're offering a lot of community college courses right in their high school. And some students, if they can manage it correctly and work with a guidance counselor, can figure out how to graduate with almost an associate's degree at the same time they get a high school diploma or a certificate in one of the trades. And I think that's just been a very big deal that I've worked on. There were lawmakers before me, Senator Colgan, who's been a strong friend of George Mason. Lawmakers before me actually paved the way, but I really latched onto that and really pushed to get more funding. Great question. Thank you.
Our next question is from Todd Gillette. He is the Democracy on Air Chair and holds a PhD from George Mason.
Hi, Senator Favola.
Oh my goodness, you're a doctorate. Oh, nice.
Every now and then I remember that.
Oh, I will call you doctor.
Right. And thanks so much for being on. This has really been an interesting discussion. A lot of really fascinating topics that you've covered so far. So I'm particularly curious to hear your thoughts about SB 1301, limiting the use of isolated confinement in state facilities. I'd be curious to hear your thoughts on also what prevented it from passing after coming out of committee, and what you think the future might be for bills, related bills in the future.
Todd, thank you for asking that question. It's a really important question. And let me just say, I philosophically believe that we should not be using isolated confinement, at least not for any extended period of time. I think it is very damaging to an individual's mental health. I think it is particularly harmful to youth. And I would define youth as individuals under the age of 21. So it's got to stop. It's cruel and unusual punishment. Now, the arguments that came up related to a bill that Senator Morrissey actually was the chief patron on, but I have been a co-patron on several of these bills as well. Sometimes there's situations where, an inmate is having behavioral episodes and could be a danger to himself or others, and has to be segregated from the rest of the population. And the way we have designed our prisons, isolated confinement seems to be the only approach, because we don't have other housing units that are, separate, which would not, constitute sort of isolated confinement. And then we've got situations where inmates may actually be at risk of being, of being attacked or harmed by other inmates. So for their own protection, they're moved to an isolated confinement. And then lastly, you would have inmates that I suppose the prisons might define as punishment or in need of punishment. They move them to isolated confinement. I do not think isolated confinement should be used for punishment, period. And now in terms of the other two reasons, if an inmate may harm himself or others, or an inmate may be vulnerable to being harmed, I think we need to create a different type of housing module that, would allow an individual to still gain protection, but not be confined to a small cell. Now, of course, that's going to take a redesign. That will take some money. It'll take, training on the part of our prison staff. And more importantly, many of these prisoners really do require long-term mental health services. And I would like to see those services incorporated into the state prison system. And I think that would go a long way in sort of solving the need for what some of the experts say is isolated confinement. So it's a very complicated issue. I just outlined some of the debate that we heard in the Rehabilitation and Social Services. In large part, the State Department of Corrections believes that the fiscal impact of such a bill, even if you were to phase it in over time, would be pretty significant. So, but that's not going to sway me from embracing the concept that solitary confinement, as we currently know it, has to end. So it's a long road ahead. Is a short answer to that, but I appreciate you asking the question.
Great. Our next question is from Susan Dressler, a leader within the Friends of Alexandria Mental Health Center.
Oh, yes. Hi, Susan. Hi. Thank you for joining this.
Hi. I'm really excited and want to thank you for all the hard work that you have done on these bills and programs. They're wonderful.
Oh, thank you.
My question also relates to mental health. Discussing, I'm assuming that inmates with mental health conditions do receive services, mental health services, while they're incarcerated. But I'm wondering what provisions are in place for them to have follow-up services when they are released, and how is that handled?
I think that's a great question. Thank you. Thank you so much for answering that. If an inmate does demonstrate the need for a mental health assessment that is provided in our state prison system, and there is some mental health treatment follow-up after that initial evaluation, I do not believe that the state provides an adequate mental health safety net in our state prison. And I think that's probably true in the regional and local jails as well. So, so we need to sort of fix that. We need to fix the in-house inadequacy. And then your regional and local jails usually contract out with the local CSBs to provide follow-up mental health care. At least that's done in the jails up here in Northern Virginia. So, and that is a routine part of discharge planning. So there you are, but it, again, when you've got individuals that need so many services when they're re-entering society, they need adequate housing, they need probably more job training, they need the support of a community and family members. And yes, they will need mental health services as well. I think it's very hard to provide that comprehensive package, although it's absolutely necessary, or your recidivism rate goes up. So we are working, part of the role of my committee is to ensure that our state-run prison programs and the guidelines provided to our regional local jails actually meet the societal goal of rehabilitating our prisoners, our offenders, and enabling them to re-enter society in a way that will allow them to embrace a productive and life, productive and constructive life.
Great.
Thank you for the questions. Great question.
Our next question is from David Drashler, and he's a member and former president of the Northern Virginia chapter of the ACLU.
Hi, Senator.
Oh, hi. It's nice to see you. Quite a team you have, David and Susan. Yeah. Wow, it's a strong team.
Thank you very much for taking our questions.
Sure.
I'm unclear on the status of parole in Virginia. I thought that former Governor George Allen had abolished parole, but I saw that quite a number of bills before your committee mentioned parole and the responsibilities of the parole board. Can you explain what the status is?
Yeah, that's a very good question. Well, individuals, can be eligible for parole. The bills before my committee this past session actually dealt with the obligation of the parole board to notify the Commonwealth attorney before somebody was released, to notify family members a certain number of days before. Although those laws were already on the books, the bills before my committee allowed that notification to be through electronic means or email. There was a bill that came before my committee that will require the parole board to post a report, monthly report on the website that not only identifies individuals who have been determined eligible for parole, but to state the reason why, what their offense was and the reason why they're eligible. So we're moving more towards a more transparent approach to the operation of the parole board. And that's what the bills did before my committee.
Awesome.
And they passed, and they did pass. I mean, they went through conference, the governor saw them, they came back, they were tweaked. And so we've been making progress though.
Okay. Our last question is from Marina Anwari. She's a business major at Northern Virginia Community Colleges.
Okay.
Hi, Senator. It's been great.
Hi, Marina. It's nice to see you.
Thank you. It's been great listening in on everything you've been advocating for and all the hard work you've been putting in. So I just wanted to thank you on that.
Thank you.
My question was, out of all the bills passed during the 2021 General Assembly session, which bill are you most excited to see implemented?
Of all the bills that passed, well, I have to say that my paid family leave bill, I desperately want to get a paid family leave program up and running in Virginia. Senator Boysko has been very active and taken a leading role on that. I have taken a leading role on paid sick days, but I did get a bill through that does direct the Bureau of Insurance to sit down with stakeholders and figure out what we need to do to get private insurance companies to enter the market. So companies can buy insurance to allow them to offer the paid family leave. So we'll see what that report comes up with. I think it's another step forward. And I've been working with the Virginia Interfaith Center on paid sick days. They are very dedicated to this. And one thing that I do feel very good about, and I'm most excited about, it was a budget amendment and authorizing, but now our home care workers who are paid through Medicaid will be able to access up to 5 sick days a year. And that is critically important. These are home care workers that are going into homes where we've got elderly, sick, disabled individuals, folks who are, medically compromised. And for a home care worker to not be able to stay home when he or she is sick, I think puts the patient at risk. And I do understand that some of these patients need 24-hour care, and the home care agencies will have to work at getting, substitutes in. But we felt it was really important that these home care workers be able to access paid sick days. And we actually put money into the Medicaid budget for that. So we're making progress. There's some big issues I really care about, and I think you all do too. Your questions have been great. You've allowed me to expand on things that I had on my list, and I appreciate that. So kudos to the George Mason team that actually pulled this together and actually produced this program. I feel very good about being a guest on your program. So.
Yes, thank you so much, Senator Favola, for hosting our Aircast and answering those questions. I have a comment from one of the people who is watching the live stream at the moment, and it's from Dr. Meredith Carey, and she says, "Thank you for your efforts on behalf of improving mental health services in public schools, protecting women vis-a-vis domestic violence, gun safety, work training, and our right to privacy."
Wow, that. Thank you. You did better than I did in just sort of putting a parameter around the things I've worked for. So thank you so much for that comment, and I will continue to work hard on your behalf and on the behalf of Virginians across the Commonwealth. So thank you.